Okay. That was a fast countdown. All right. Good afternoon. Again, I'd like to start by saying that we will take our masks off when we speak, because the purpose of what we're doing today is to communicate with the public, and we want to make sure that the message is received loud and clear. Everybody in this room is wearing masks. Everybody is 6 feet apart. But for the purpose of communicating with the public, we'll take our masks off when we're speaking. Since the last update on Tuesday the 21st, at that update we talked about a cluster that was forming out of a religious gathering near Croghan. When we spoke on Tuesday, there were 6 positive cases in the cluster, with 9 symptomatic folks awaiting test results, and at that time we had 72 people quarantined. Today, we have 21 positive cases associated with the cluster, with 26 symptomatic people awaiting the results of tests, and 252 people are quarantined. In addition to the Apostolic Christian Church on Route 812 in New Bremen, we have 2 additional locations to make the public aware that there was exposure at these spots. The Hook and Ladder restaurant in Montague, if folks were there on Sunday, October 18th between 2 and 4, we would ask that you contact public health, because you may have been at risk of exposure. Additionally, folks that were at the Pioneer Cafe in Glenfield on Tuesday, October 13th between 1:30 and 2:15. Again, those folks should contact public health, because you may be at risk of exposure. The reason that we are communicating today is not to cause panic, but to communicate clearly the situation that we're in Lewis County. At this time, we would define the cluster as uncontained, meaning we do not have all of the contacts identified, and we have not isolated everyone who is associated to this cluster. So basically what that means is that there is still exposure risk in the community. Everyone who is exposed and could be positive has not been identified. We're working very hard to do that, obviously. Our actions in the next 48 hours as a community are going to make a big difference. Containing this cluster is going to be very important, because we have a very small population. And yes, we're spread out over a large area, but the state calculates their cluster zones. You've probably seen the micro clusters on the governor's press conferences. Those are calculated based on population density and based on positivity rate. And so what we really don't want is to slip into the yellow precautionary zone. And if we were to slip into the yellow precautionary zone, that would mean that we would have to go backwards and start closing schools and businesses again. And that is something that we absolutely want to avoid in Lewis County. So we're working hard to find every single contact and isolate those folks. We want to be very clear: if you are quarantined, or if you have exposure through one of these locations and you have symptoms, you need to get tested as soon as you're feeling that you have symptoms. We have clinics available, and we have folks, in this scenario that can get you in very quickly. Jerry's going to talk about some increased capacity we have for rapid testing in Lewis County, but I think the message needs to be, very clear to folks. If you are part of, this exposure, potentially, and you have symptoms, it's very important that you get yourself tested right away and report to public health as soon as possible. With that, I'll turn it over to Mr. Kerr, the CEO of Lewis County Health System.
Thank you, Ryan. I have 4 items to review today. The first is I want to give an update on test kits, and specifically rapid test kits that we have received since our last briefing. Since our last briefing, we have received 1,200 test kits. 500 of them are the Abbott ID Now, which is run on an Abbott analyzer. And so we are well positioned in the short term to meet community need. In addition, we've received 700 antigen tests. And the benefit of the antigen test is it's a great screening test for asymptomatic patients. And we have 700 on hand, and we are receiving an additional 500 early to mid next week. So we're going to be able to meet our needs there. I also want to echo, and this is item number 2, as soon as you are showing symptoms, you need to arrange to get tested. And to help support that, item 3, we are testing consistently 5 days a week, and there are 2 options for the general public. One is the state-sponsored clinic from 11 to 12, and then mid-afternoon it's our call first by appointment testing program. We are going to add a 6th day, and tomorrow from 9 to 11 we will also be testing. And I will consult with Ashley and her team over the weekend to determine if we need to open clinic on Sunday. So that will be determined, and if it is, we will send out a press release. The 4th item, I want to acknowledge and thank the team of professionals who have been working the clinics and getting the samples. I also want to acknowledge the lab where all of these samples, the lab personnel who are processing these test kits, they have been working essentially nonstop to make these services available to our community and doing our part to support the information Ashley and her team needs so that they can engage in contact tracing. Thank you.
Okay. One additional update. Board of Elections has asked me to let the public know that absentee ballots are still available. You can still get your absentee ballot. They are available on our online portal, or they're available by phone. You can call 315-376-5329. A lot of people have been trying to get through today because of the recent news here. They're thinking they might want to avoid the polls in a couple of weeks. So we want to let them know they can vote absentee for any reason in New York State this year. And also early voting is available in Lowville, at the Town Hall in Lowville during business hours. So with that, we'll take any questions.
Right, I have one.
Yeah.
So you said 21 cases stemming from the church. Is that all today, or is that just the total, including yesterday and the day before?
Right now, the total cluster, including the 6 that we talked about on Tuesday, the total cluster stands at 21, with 26 additional people experiencing symptoms.
Okay, gotcha. And
So-
then, go ahead.
Does that mean 6 cases were added today then? And were there any other cases that are not affiliated with the cluster added today?
Ashley?
So, yes, we had, I believe, 2 that were not affiliated with the cluster added today. So, as of right now, we have a total of 97 cases. We've received 27 this week.
And can you just clarify, just because I think it's kind of an important distinction, when you're talking about a religious gathering, do you mean it like an actual church service or like a special event, say like a wedding, baptism, funeral, something like that?
Both.
Okay.
And so, Ryan, you said it was 21 cases from the cluster itself. How high do you think this number could go? What's the concern there of how much exposure that there is? How high could this number go, do you think?
Well, I don't think it would be wise to speculate, but I think it's fair to say that folks that are experiencing symptoms, that we have a reason to believe we're in direct contact with people who are positive. There's a strong likelihood that a portion of those folks are going to be positive as well. So of the 26 that are symptomatic and awaiting results, I think it's fair to expect that some of those will be positive as well.
When you're giving us numbers on the cluster, is that relating to just people that reside in Lewis County, or are there other cases of people that might live in a different county or a different state that are part of this cluster as well?
We're giving you just Lewis County numbers right now.
Are there other cases associated with this? Like, are there people that live in Jefferson County maybe that are part of this cluster?
There's other counties, yes.
Can you give us a total number of what the cluster looks like so far, or you're just giving us the Lewis County?
I'm just giving you a Lewis County number right now. I can get that information. That changes as well as those cases take it and spread it within that county.
And we've heard people going to like Utica and places like that to get rapid tests that are showing symptoms. Do you get those results just like you would any other results for residents of the county?
Yes, anything is required to be reported through the statewide laboratory reporting system, and that is a New York State Department of Health regulation for anybody that's doing the COVID testing.
Okay. And could you just, for the public, I had a couple of, quite frankly, disturbing phone calls yesterday from a number of individuals, and I was just wondering if you could clarify to the public, the importance of testing and things like that. Basically, a couple of the conversations went along the line of, they were symptomatic, but they're not going to get tested, and kind of the mentality that, they're doing the community a favor by, getting the virus out there. So what's your message to people that, and it's really not one-offs. I mean, literally from messages we've been getting and phone calls from people that just don't want to participate in the testing end of things. What is your message to them?
Individuals may think that this is not a serious virus, and it is true for the majority of individuals. They will clear the virus and they will be just fine. But there is a subset of our population that is highly at risk for becoming very ill. We have 2 people that are hospitalized currently, the elderly, anybody that's immunocompromised, and we've seen around the nation that there's been many deaths from this. So yes, for the majority of people, you would be fine, but we need to protect those that need that protection, and it's everybody's responsibility to do that.
Can I add on to that?
Sure, please.
So I think what's important here, because we've seen, some of the comments as well, I think that regardless of politics, regardless of personal beliefs, what matters right now is the fact that we do live in a state where if you have certain positivity rates, there are consequences. And so regardless of how you feel or how you may feel about the virus and how dangerous it may be is kind of irrelevant, because I think we all agree that life is better when school is open. I think we all agree that life is better when we can go to work and our livelihoods are protected. And the fact of the matter is, people's personal beliefs about COVID-19 are irrelevant to whether we would be able to keep school open or whether we would have to close businesses. So I think people that are choosing actively not to take things, the virus seriously, are behaving selfishly and could have consequences not only with the health of their friends and neighbors, but also keeping our economy running and keeping kids at school.
Let me jump in real quick.
Yep.
So you said 2 have been hospitalized. Is there a possible way to get an update on their condition, and has one of them been transferred to Syracuse?
We will not speak to any details of the health of individuals, right, Ashley?
Correct.
Yeah, sorry.
That's okay. That's not it.
I think I would also add there is no science that supports the development of herd immunity the way that you've posed the question. There's absolutely no evidence that works. So we're putting people at harm and gaining nothing. And with regards to the hospital, we only have a certain capacity. We are a 25-bed critical access hospital. And when I left for this briefing, 15 of the 25 beds had admissions. So if we don't contain this, we will challenge the resources of our community in a way that we will begin to experience what some of the southern hospitals in New York State experienced early in the pandemic.
Are you still at double capacity from measures that were implemented in the spring?
No, we have the ability to surge up. So as the pandemic was contained in New York State, late spring into the summer, we began operating with our licensed capacity. But if there is significant growth, we will have to surge up, and all of our rooms become two-person rooms. And we have built up a very strong inventory of PPE. So we are depending on the day of the week between 90 and 120 days. So we have worked hard, our team has worked hard bringing in supplies in the event there was a second wave.
How many isolation rooms are available for COVID patients?
Right now we have the ability to, I believe our new number right now is 12 rooms. 12 rooms we can create negative pressure.
Okay.
And so, Ryan, you call this uncontained. Does that concern you that this is an potentially uncontained exposure? And how close are we, Lewis County, to the yellow zone? You said that you don't want to reach it. What's a realistic way of reaching that we want to try to avoid?
So first of all, we're working with the governor's office to understand what the zones mean. We are still, I think it's safe to say that 21 cases, even if it, potentially goes up into 30 cases, that's still a relatively low amount for the size of the county and the population we have. However, if they're concentrated in a certain area, then we could be put in to those categories. So we're working with the governor's office to understand what the parameters are and what are the consequences of getting put into the yellow zone. But to your larger question, am I concerned? I don't think concern is the right word. I think what we need today, what the three of us are asking for, is for the community to step up over the next 48 hours. This weekend is incredibly important for containing this outbreak that we have. There's absolutely no reason why we cannot remain one of the safest communities in New York State with COVID-19. There's absolutely no reason why we can't remain one of the few areas in upstate New York that's allowed our kids to have sports, that's allowed our kids to have in-person education. How phenomenal that Lewis County's kids have been able to go to school. You know how rare that is right now across the United States? And what's unfortunate is that if we aren't able to contain this and people in our community don't behave appropriately this weekend and into early next week, then we might not have that choice. And that is concerning to me, absolutely.
And then speaking to the two new locations, one, is it, do you think there were, do you know how many, is there a concern that there were a good amount of people in them? And then two, were there sign-in sheets or any kind of contact tracing efforts at those two locations that you know of?
So I can answer it. If we publicize the name of a location, it's likely because we didn't have sign-ins to know exactly who was there at what time. As far as we know, these businesses were behaving safely, okay? Mm-hmm. It's not about safe or not safe. We think they have been very safe, but even in safe conditions, if you have someone who's actively symptomatic in those locations, we want to make sure that we're talking to those folks, asking them how they're feeling, asking them if they have any symptoms, and if they do, we can help get them tested and get them into our quarantine protocol. So that's why, I think that's an important point, actually. We don't want to publicize anybody's business or organization. We prefer not to. So if you don't want your organization to be part of our announcements, then a sign-in procedure will help a lot. So that's a great thing for all of our businesses and organizations to put into place this weekend would be sign-in protocol.
Back to the earlier question, Ashley, with I think we have the most amount of people in quarantine and isolation that we've probably had since the beginning of the pandemic. So from a public health perspective, as you're doing your contact tracing, are people generally being cooperative with the process?
Yes. This group of people has been very cooperative.
Okay. And can you tell us, I think you said that there was 252 in quarantine pertaining to the cluster. What's our total? Do you have what our total quarantine number is for the county right now? I know yesterday it was like 348 or something.
I don't. I will have that in the press release. It's growing as we speak, as they are doing the case investigations.
Okay. At Tuesday's press conference, it came up that there was people from out of state at this event. Is it public health's opinion that the virus came from out of state, or has it been traced to out of state? Or?
We have not been able to officially trace that, no.
Okay, so you guys haven't made it to like patient zero or whatever for this cluster?
No, and sometimes you don't get there.
Right, exactly. Okay. And Jerry, a follow-up on the rapid testing. Can you just explain a little bit about, and I'm not sure if you have this information or if it comes from the governor's office, but how the allocations are determined? I think the county was getting a regular allotment of rapid tests before this cluster broke out, or not?
We received maybe a month ago an inventory of rapid tests, and I believe that number was 300. And over the course of the month, that number dwindled. That number got to a certain level, and I forget how low it was, without the vendors that we typically use unable to fill their orders, the orders that we had placed. And that was happening because of the disruptions to the supply chain, both nationally and in the state. So I called the governor's office, we explained our situation, and they stepped up, and that's what resulted in the 1,200 tests that we received a few days ago. At the same time, there was an application that went to the DOH around ongoing rapid test supplies being available. And Ashley and I spent some time on this, and there's another important segment of our population, and those are the district schools. And so we wanted to create an inventory of rapid tests to support schools and to support the general public. Those two together, we've put in a request for 600 rapid tests per month. Now, one of the things that the state does, whenever there's a request, it's not like you make a request to one office and a different request to another office and the two don't connect. There's a database where the requests from Lewis County are fed. And so the inventory we received this week will actually help determine the future delivery schedule for rapid tests. So it will help determine the par levels of rapid tests for us. I'm actually very pleased that we are getting both the Abbott ID Now tests. That's the analyzers that the state provided to us. They work incredibly well. They're reasonably fast. From start to finish, someone can know in about 40 minutes from start to finish. The other test is the antigen test that I spoke of earlier. What I like about that is it's a much more affordable test. So when you are doing asymptomatic community screening, it is the cost-effective way to do it. and there's an appropriate level of reliability. And so having both options allows us to be strategic. So over the last 48 hours, we've had several conversations with public health, and we have been very open to listening to public health's recommendation. We'd like to see this person get this test so that we can get information back quickly to public health so that they can initiate contact tracing. Because the sooner they have it, the sooner I think we will get to containing this cluster.
Any update on the analyzer that the hospital purchased back in the spring? I know the last we spoke, they were still waiting for
Yep.
reagents.
I'm going to sound like a broken record on this one. I actually spoke with our lab director earlier this week, and he said his last communication, which was earlier this week with Cepheid, is that by the end of the month, we will have those rapid tests available to us.
Okay.
So, we keep our fingers crossed. However, we can't hope and support community needs, so we've been fortunate the governor and his staff have come through for us in making available the rapid tests that we do have.
We received information this afternoon that Beaver River was going to be moving to a fully remote learning schedule over the next two weeks. Was that decision the school's decision, or was that something that the county kind of had input in or requested for the school to do, given the situation in their community?
That was 100% a school district decision. I mean, we've been in constant contact with not only Beaver River, but all the school superintendents and BOCES leaders, but that's a school decision.
Okay. And given the situation that we're currently in, would it be fair to ask for public health to provide us with the daily updates throughout the weekend, this weekend, or?
Yep.
Okay.
And so you said you were working with the state to determine the yellow zone and all that information. So is the state aware that there were people here that were supposed to quarantine that didn't? And if so, what's the course of action? What potential courses of action are there for that?
I wouldn't be able to speculate what the state knows and doesn't know. What I know is that the folks that we work with on a daily basis have been very helpful. They understand, we're not the only place in New York State that's had a cluster, so it's common, unfortunately, but it is across New York State. There's no consequences, I don't think the governor is going to call the governor of Ohio and say, keep your people away. That's not the state, I'm just saying. It's so I don't know. I don't think there's much we can do. I think that's in the past. I think what we need to focus on is what we do going forward and how we as a community respond, so that we can keep our schools open, we can keep our business open, and we can keep everybody safe going into the winter.
One more. You said you were talking about it, and we talked about it at one point about having the surplus or having a supply for students for school districts. And we're kind of seeing that playing out right now with the Beaver River, 100 or so students in quarantine. How does this kind of real-life example show the need for these rapid tests from the state, or how is it kind of seeing this play out? What does that kind of mean for you? Can you speak to that a little bit?
Yeah, so we're actually, earlier today, we're dialoguing with all of the schools. And one of the things that we're working on is how to operationalize quickly testing large numbers of students. And if we end up as one of these red zone communities, 20% of the students in each of our school districts will have to be tested on a weekly basis. Operationally, we really have to work through the process of how does that get accomplished. We have a large geography, our schools are spread out, and 20% every week. So now there's a testing supply issue, and there's a workforce issue. Our schools do not have clear waivers, which means they don't have the ability to run laboratory tests. So we will have to find a way to staff up, to partner with the schools so that we can test that level of students. There's an incredible responsibility with reporting to the state when we run these tests. It takes several minutes for each form to be inputted into the database. So there's this administrative responsibility. The schools, as you know, are struggling with having adequate space to meet their needs as they've gone to the hybrid model. Where would we set up, So we just today began that conversation. As it relates to Beaver River specifically, a conversation with the superintendent earlier today was how could we utilize the antigen test, which is the asymptomatic test that you don't need an analyzer for, to help generate more information about his student body. So I've used with my team, this is incredibly fluid and is changing, it feels like by the half hour as we get new information. And where do we put our resources? So right now where we're putting our resources, we will spend more time with the schools in the days and weeks to come, but right now I believe the highest priority is to make sure we get information to public health so they can quickly and effectively begin contact tracing. And two, we need to make sure that we continue testing the populations we've been testing all along. That is the preoperative cases, the admissions to the ED, the admissions to medical surgical, and then any symptomatic patients not associated with this cluster who are working their way through all the physician practices in Lewis County. So there'll be more focus on the schools to come, but the current priority above all is related to this cluster.
With the request for people that are maybe experiencing some symptoms that you want them to come and get tested, with such a high number of active cases in the community right now, are there specific symptoms that you're seeing people have more often or not, or does it just depend on a person? What kind of things should people be looking for? I know we've heard a lot about it since the beginning of the pandemic, but is it still the same cough, sore throat, that type of thing?
Yep, I would say the majority of these cases are cold symptoms, cough, some shortness of breath, runny nose, just fever. We have had quite a few with fever, and general achiness.
And then, so with this current cluster, I know there's asymptomatic and symptomatic. Are you finding more people this time around are coming down with some of these symptoms instead of having less, more asymptomatic? Is it more people with symptoms nowadays? How are people feeling more sick with this than in the past?
I wouldn't necessarily say the symptomatic people are more symptomatic, but then our early cases, we are seeing that these are all symptomatic individuals.
So we'll wrap up. I think the best way to conclude is to say that there is good news. The good news is that we are smart and this virus is not difficult to defeat. We have to do very simple things. We have to wear masks. We have to wash our hands. We have to avoid gathering indoors in large amounts. We have to look at public places and make sure that we are limiting building capacity in those buildings. And if you are feeling symptomatic and if you have been in contact with someone from these locations or you've been there yourself, it is important that you go in, get tested right away so that we can contain the virus and keep our businesses open and keep our schools open. So thanks again for coming, guys, and that'll do it. Thanks.